Hello and welcome to It's Personal, Reimagining Public Services Around Citizen Needs, a brand new podcast series where we dive into what it really means to create public services that work for the people they are designed for. I'm Jess Bowie, co-editor of Civil Service World, a job I have been doing for perhaps longer than I care to mention. Suffice it to say that I've been writing about government, policy and public services for quite a while now. And with me is my fantastic co-host.
My name's Jo Thomson. I'm a lead partner for customer transformation in the public sector at KPMG.
So over the next 5 episodes, we will be exploring how we put citizens at the heart of service transformation. We're going to be chatting about what's working, what isn't, and what needs to change to make public services more effective and accessible. We will be speaking to some of government's most senior leaders about their successes and their struggles when trying to deliver for citizens, including on this episode, Sir Jim Harra, the outgoing Permanent Secretary of HMRC. And Jo, who else are we going to be hearing from on the series?
Well, in my world, what we do for a living is all about impact on public service outcomes and in particular impact on the citizen. So it's really important to me on this podcast that we actually bring the voice of citizen into it. So you're going to be hearing from normal people, dare I say
people,
it,
no
who are
way.
experiencing normal services in public sector.
Brilliant. And Jo, one of the reasons that we have come together to do a podcast is because KPMG has just published its annual Citizen Experience Excellence report. Can you tell us a bit about that report?
I mean, we have a think tank that's been going for 15 years now. It analyses what customers think of the experiences they have of services in the UK, and that's now measured globally as well. And what we've done for the last 5 years is that we made that really specific to public service. So we have 5 years of data from over 130,000 citizens giving their views on what it's really like to be on the receiving end of service. And from my perspective as a partner leading transformations in government, local government, healthcare, transport, education, bringing that social, human, emotional impact into those transformation programs is really important to me. So we've got some cool data to share with you.
Okay, brilliant. And when I've been reading the research, I keep coming across the phrase, the 3 R's. I'm assuming that those are not reading, writing and arithmetic.
Nope. So this year we've been looking at how feedback has been telling us very similar themes from last year around how we properly engage the digital citizen. The majority of citizens in the UK have that digital access. Not all, but the majority do. And the feedback is loud and clear that citizens want us in the public sector to do that even better, provide that accessibility and joined upness even better. Some of the feedback we got from our readers last year on the report was that they want to see a little bit more how to. Okay, yeah, we know what the problem is, but what do we actually do about it?
So they wanted you to take the data and then make some recommendations.
Correct, yeah. So rather than just being insight-led, we've taken it one stage forward. And what we've done is we've come up with this thing called R3, which is that there's a rally cry for 3 big things right now in today's society. The first one is really remembering citizens. So rather than people having to start over and over again and repeat the same information, find some way of, within public sector, of remembering the human being that they're dealing with. The second one being around recognising needs, tuning into the needs of each individual in society and tailoring service accordingly or tailoring channel accordingly. And the third one being around respect. And that's massive in public sector. There's a huge degree of trust and empathy when it comes to the people who are providing public service. But what citizens are asking for is, rather than just being friendly, actually seeing that all the way through. Whatever stage I'm at in the journey, respect me and respect my time.
Respecting one's time is a really interesting concept because I think often if you are waiting on a queue to a DWP or HMRC call centre for upwards of 45 minutes, it doesn't feel like you're being respected necessarily. So those are the 3 R's. That is good to know. That seems like a really useful way of framing things. Now then, as an editor, I'm always asking civil service world's contributors and interviewees to give me real world examples to illustrate their points, or as we hacks call it, put in some colour. So the journalist and budding podcaster in me was delighted to hear, as you said earlier, that we, alongside the written report, that you had done some little interviews with citizens, members of the public, about their experiences of public services. How did you go about getting those?
We love going out and asking, and one of my big bugbears is anecdotal insight. I think it's really important to present an evidence-based view of what matters most. So these particular Vox Pops really epitomise some of the research that's come out this year. And they're from people who were in a cafe in Bristol.
Perfect. Let's have a listen.
I was only made aware yesterday that if you go to see your local hospital and you've got an NHS number, which everyone's got is individual to you, that information, your information onto your NHS number does not get passed on to other trusts. So say, for instance, we're in Bristol and I go to Cornwall and I break my leg. What they have on their systems is not the same as what they have up here, and they don't communicate. And I was really surprised by that. As I say, if you have an accident or you give birth in another part of the country but you live further away, they won't have that information. It won't be transferred. It's not one big database. Apparently, all the NHS regions are all separate. They're all on different computer systems. Communication there's a big breakdown there. Basically, I think they need to have one large database that is accessible to everyone. What's the point in having an NHS number if all your information is not stored under that for everyone in the country to be able to see? Obviously, I know there's data protection and things like that behind it as well, but surely that's why you've got an NHS number, the same as if someone looks up your driving licence number. It doesn't matter where they are in the country. If you've got a driving licence, your number is unique to you, the same as if you've got a passport, that number is unique to you. So I think if they could communicate better and have a better structure and better system so that my GP could find my details under my NHS number, my local hospital could, but also if I went to Glasgow, they could find my details as well. I think that would be really useful.
There was a situation where sometimes I get a bus to work. I have to get 2 buses to work as well. This is like North Bristol, so the first bus is at 4:25 in the morning, so very early. So when I try to get a day rider, it actually expires, like the day resets at 4:29. So if I buy a ticket at 4:25, a day rider, by 4:30, I need a new one. So which is a bit of a hassle. So for myself, I know it's not just me that's in the situation, because other passengers get involved with the conversation, being like, this happens to us. So you just have to communicate with the bus driver, explain the situation, and be like, look, do you mind if I just sit there and ride the bus for 5 minutes and I'll scan my ticket? Sometimes they don't. Sometimes they're like, no, you'd buy a ticket for 5 minutes, which is a bit silly. I think I'm quite fortunate that I'm not financially struggling for a bus ticket for extra £2. But for the public that are, it can ruin their working schedule. They might have to be like, I can't go to work, I have to get a new job, etc. So I actually contacted First Bus, and they just gave me a generic answer. Be like, look, this is how it is. 4:29 is when the bus resets. So yeah, it was just really unhelpful. You can tell the people that made the rules up, they probably don't use the bus. So it's they just thought, all right, this is a good time. No one will be using the bus at this time. Let's get a new one. But there's a reason why the bus is running that time. Maybe even change the bus schedule and just start 5 minutes later. That way it'll stop a lot of headaches and make it easier for everyone.
Talk about computer says no. I feel like between them, those 2 case studies pretty much covered off the 3 R's, the NHS failing to remember the lady or indeed respect her time, and the bus service seemingly being completely incapable of recognising or empathising the man's specific travel needs. Now, Jo and I have decided to take our cue from those Vox Pops so that listeners can get to know us a bit better. We thought we would share 1 or 2 personal experiences, and that's not just because the podcast is called It's Personal, but also because public services affect all of us, even nerds whose job it is to think about them all day. So, Jo, let's start with you. Have you had any particularly good or bad experiences with public services?
I think I need to start with the fact that I am here in a public sector role because I want to help our clients really make a difference, particularly with that human, social, emotional connection that we have with citizens in the UK. That's really important to me. So I'm in awe of what we deliver in the UK. Yeah, it's not perfect, but what business is? A good example for me would be probably quite an extreme personal one where 10 years ago I was diagnosed with leukemia.
Oh, God.
It was pretty aggressive and I was locked in a hospital room for 6 months and was on the receiving end of the most amazing care from the NHS. It was very personalised to me. It was very empathic, not just to me, but to my whole family. And I look back weirdly, fondly on that as one of my good memories from public service. And, thankfully I'm all good now.
Yeah. Well, no, that's good to know. That sounds like such an ordeal. And I'm very pleased to hear that you've got a clean bill of health. What I'm about to share completely pales in comparison to what you went through with your leukemia. But I, in 2014, was diagnosed with a rare tumour in my neck. And obviously it was terrifying, and it took a while to get the diagnosis right. But my whole treatment, from the kind of diagnostic stuff through to my stay in hospital, the operation, the communications from all the doctors, the aftercare, sort of months of aftercare, I couldn't fault the NHS for the service I received for that. So that's kind of comparable experience. What about a bad experience you've had with public services?
I was thinking about this because the story I shared was very personal to me. But then when you aggregate it up and you look at digital experience, for example, I think we all know that we're on a journey in public service. So it's clunky. It's not perfect. It's great when you get the DVLA quick turnaround or the passport experience being a quick turnaround. In fact, they've come out in one of our highest rankings this year in the report, which is really cool. But I think from a citizen's perspective, the more time and effort you put into a digital experience, the more frustrated you get by it.
Yeah.
Do you know what I mean? You want it to be easy. And right now, it's not. It's clunky. And another big concern in government and with customers, citizens, is how their data gets shared. Our research tells us that confidence in data security is actually really high in public sector. I don't know if you've had any personal experiences of that.
Well, my confidence in digital security, fine, maybe, but I was kind of on the receiving end of some very unjoined up NHS data this Christmas just gone. It was more akin to actually what the lady in the first Vox Pop was talking about, and I should definitely take her for a drink and go for a good old moan. But I was in Oxford with my in-laws and I had weird heart palpitations that went on for hours and hours, and it had never happened to me before, so I thought, better get this checked out. I went to Oxford's John Radcliffe Hospital. It was 11 p.m. on December the 30th. I was already feeling pretty far from zen, but what really didn't help me was getting a telling off from the receptionist about my address. Apparently their system still had me down as living in North Oxford, even though I hadn't lived in Oxford for 21 years. I told her my records had been updated countless times and that I had used the NHS loads of times over the years in Cambridge and in London, and they had always had my correct address, but she wasn't having any of it. According to her, the information she had on her screen was NHS-wide, and the data really shouldn't be saying that I lived in Oxford if I didn't. And I wanted to scream at her that this was not the case. It was just her ancient computer system still clinging to the details from when I broke my arm sliding down a banister, age 11.
Ouchie. Are you still doing that now, 21 years later?
I think my days of sliding down banisters are sadly over. But yeah, quite aside from the scolding, it was just another reminder of how horribly fragmented NHS data can be.
And it would be really interesting to have that point of view and an update on that, because there's a lot of work going on right now in the NHS to improve that, and maybe we can have one of the
we can have the receptionist on. No, you're right, and I keep hearing things, but as of December the 30th, 2024, it still felt very fragmented, but I know there is all sorts of work going on.
And it's funny because in all of that, what you were looking for was a resolution. I think sometimes we forget that when we're under pressure or the systems aren't working properly for us. You take my mum, she had 2 knee replacements in a short space of time, one of them involving sepsis, so it was all quite stressful. She then had something removed from her bowel at the same time. There was a lot going on from a health point of view, and what that meant was that led her to being given advice that she needed to get a blue badge so that she could get in and out of the car. She's quite immobile now. She's 86. So, from her perspective, she wants that quick resolution on a blue badge. And she found the process really complicated. She went down to her Citizens Advice Bureau. They really helped her through the process. They were able to accelerate it. She got the resolution that she was looking for, but it was quite clunky for her.
Yeah.
But that said, it was a good outcome, and they loved her so much they offered her a job.
Citizens Advice. That's amazing. But your poor mum, you shouldn't have to go to Citizens Advice just to get a blue badge. So poor her.
So, I guess that's what this podcast series is all about, understanding what's really important to citizens and trying to make that better, but at the same time helping those that are providing public service give the best human, social, emotional connection that they can in whatever they're doing and whatever stage of transformation they're at. So when Jim Harra joined the Inland Revenue in 1984, it was only supposed to be a summer job. After all, he'd soon be leaving Northern Ireland for London to start a master's in patent law. Instead, he was bitten by the public service bug and remained a civil servant for the rest of his career. Born and raised in the small village in Northern Ireland, Jim began his career as a government tax inspector in Belfast. 3.5 decades on, he was still on the payroll of the UK's tax administration, but he was the man in charge, running HMRC's workforce of around 70,000 staff.
Then, this April, after a full 40 years, he retired. It's hard to fathom just how many changes Jim lived through, watching HMRC slowly morph, on the one hand, from a paper-based organisation run out of hundreds of little local offices into 14 regional centres, and on the other, from a setup where taxpayers couldn't interact directly with the tax system, they had to deal with civil servants who were the intermediaries, to one where they could just go online and do things for themselves. When CSW caught up with Jim a few weeks ago for an exit interview, we covered a lot of ground. 40 years is a long time after all. Unsurprisingly, we talked a lot about customer service. We started by asking him how HMRC ensures that it designs services around the citizen, and also, given that the tax authority has such a wide variety of disparate users, how it goes about developing services that meet all of their needs.
So first of all, we have a user research team and we have customer labs where we bring members of the public in and test our services with them. And also our new digital services are released in beta form. They're available for testing by the public and we then iterate them based on that feedback. But we also have a whole range of ways of getting feedback from our customers, right from what the frontline advisors get told through to formal complaints. We use all of that. We want tax really to fit in with how people live their lives and run their businesses. So we wanted it to be automated or effortless, if that's at all possible. But where people do need to do something to meet their obligations or receive their entitlements, ideally we want them to be able to self-serve online and do that themselves, with us there to guide them if they need support to get things right or to intervene with the minority who want to abuse the system. So we really see ourselves now as stewards of a system that other people use. Our services do have to be universal. We touch almost every adult in the UK, and obviously all of those people have got differing capabilities and differing attitudes to compliance. So as much as possible, the service is for use by everyone, but it can't be one size fits all. We've got to be able to deal with those people who need support or need extra help. So we want to encourage everyone to try to deal with us online if they possibly can, because we've got great digital services and lots of the things that you need to do or lots of the information you need to find out are quite accessible through them. But we know that some people won't be able to use our digital services. They might have complex affairs that mean that they just don't feel confident doing that, or they may be digitally excluded, and we'll always be there for the people who need that. But the more the digitally able use our digital services, the more our advisors are there available to help the people who really need them.
Next up, we asked Jim whether AI and automation would save the day when it comes to improving customer service.
I mean, we've got a long track record of automation. We don't want our customers or our staff spending time on processes that can be automated, and I'm sure that's routine actions. That's something I think that will continue into the future. And increasingly now we're using automated voice platforms and online chatbots to deal with customer queries as well. So moving from processing into actually the relationship with the customer. And we've started to use generative AI to make our people more productive. So everyone in HMRC now has access to Microsoft Copilot, and we've also developed an AI tool that writes the summaries of customer calls, and that reduces the amount of time that our advisors need to spend in wrap up and enables them to get on to helping the next customer. So most of our use cases for AI at the moment are about improving colleague productivity, but we are also currently participating in a pilot service with the Government Digital Service of using generative AI to actually answer customer queries as well. So I think it's got real potential for the future.
We also wanted to hear from Jim about the issue of failure demand, which loosely translates as the extra unwanted demand on a service or system caused by a failure to address a customer issue early enough in the customer's journey. In the year to March 2024, HMRC estimated that 72% of their calls were due to failure demand. That was up from 65% in 2019. How had he and colleagues been responding to that rise?
A significant proportion of the customer contact that we get is avoidable. We reckon about 2/3 of it is avoidable. That may be down to customers contacting us about things that they could easily do online, maybe about them contacting us to chase progress because we've got a backlog somewhere. So that shows you the scope, I think, to reduce customer demand and really focus our customers who need extra help. So we've been really pushing our digital services. We've also, in the last year, really improved our handling of posts. So we are now exceeding our targets for turning around posts, and that is reducing the amount of contact we get from customers chasing progress, asking where their reply is. And we've also been using sort of customer feedback loops to identify where we need to improve our guidance. So, for example, some recent improvements to guidance on self-assessment repayments have reduced the contact demand on that by about 50%, but there's lots more to do.
Finally, we asked Jim how HMRC was working with other government organisations to ensure, as far as possible, a seamless experience for citizens who need to deal with more than one government agency.
In the past, we often talked about joined up government services when in fact we didn't have the capability to do it. But I think with digital now, you really do have the capability to do that. And some examples of how we've been doing it is, first of all, we are participating in one login, which means that citizens can log in once using government digital service and then access all the different services they need, including HMRC's. We've also, if you go onto the HMRC app, we've got a state pension forecast there, which is actually a DWP service, but we host because it fits well with what we do. So where it makes sense, we want to certainly make sure that people can access our services from other parts of government and other government services from our services.
That was really interesting, and it was so good to hear about the journey that HMRC is on. And it really does feel quite pertinent to the themes of our KPMG research, particularly that last point about one login, which is exactly the sentiment of Remember Me. Mm-hmm. Joining up services through single front doors, designing the journey around citizens. It's certainly what we're used to in banking or retailing, but less so in public sector. Mm-hmm. So we know it can be done, but there's a big change required in public sector. In fact, so much of what Jim was touching on throughout that interview will be cropping up in different ways throughout the podcast series.
So in the next episode, we'll be hearing from Matt Briggs, who is currently leading DWP's service modernisation programme. He'll tell us all about how he's championing putting customers at the heart of design. He also led the delivery of the Tell Us Once service, another service which was designed very thoughtfully around citizen need.
I really can't wait to hear Matt talk. He's a voice of wisdom when it comes to the years of experience he has in DWP. The rest of the series will carry on that theme, particularly exploring Remember, Recognise and Respect Me, and how we can demystify even the most complex cases in public sector, with some really cool guests sharing their perspectives of putting it into practice.
So that's what's in store. We are really excited to have these conversations and to hear from some inspiring public servants along the way. If you work in or around public services, or if you've ever interacted with them, which, let's be honest, is all of us, we would love for you to add us to your podcast feed. And if you have thoughts, experiences, or questions that you'd like to share, do drop us a message on csw.editor@civilserviceworld.com or find me or Jo on LinkedIn. We would love to hear from you.
We'll see you next time for episode 2.
Bye for now.